Hello, and welcome to Module 4, Strategies for Mentoring in Hand Therapy. The purpose of this module is to provide a brief overview for mentoring as it specifically relates to hand therapy, and to provide practical resources for the mentor as they apply the mentoring strategies learned in this course to mentoring in the clinical setting. Let's take a moment to reflect on all of the pieces of the puzzle. First, mentors need to be ready and willing to make the commitment to the mentoring process. This process will take extra time, effort, and preparation for the mentor. As we consider the learner, keep in mind possible generational characteristics and differences in their unique learning styles and preferences. Having them take a learning styles inventory will provide you even more insight into how they learn. Make a mentoring contract. Establish a plan and set expectations and goals. Provide learning opportunities and a safe space for the learning process. Facilitate critical thinking and give positive reinforcement. Throughout the process, invest in the relationship, care about the mentee, and care enough to be interested in them not only as a therapist, but as a person and as a friend. Remember, they are your colleague, not your student, so treat them that way. All of these things work together to facilitate the mentoring process and to help us provide excellent care to our patients. Let's look a little more in depth about facilitating critical thinking and clinical reasoning. It is important to avoid just giving answers. Instead, ask open-ended questions that provoke thought and reasoning. These are questions such as, what is happening with this patient? Why do you think the patient is presenting this way? What interventions would you recommend and why? When should you advance their treatment and why? How would you solve this problem? What did you learn from this case? Where were areas that you struggled and why? Give insight. Point toward the evidence. Provide resources and guide the mentee in the right direction, but also give them the opportunity to think and talk through each case on their own. Reinforce what was done correctly, but also correct mistakes. This will help them to become more independent therapists who will be an asset to the hand therapy profession. While this is not an extensive list, these are some of the core competencies required for a CHT to possess to not only pass the CHT exam, but also to practice effectively as a certified hand therapist and to provide quality care to their clients. At the end of the module, there will be a link to resources and a more thorough list of knowledge and skills that are required from the mentee seeking to enter into the specialty of hand therapy. According to a study by Cash et al. In 2003, it takes the first year of practice to develop the skills of choosing treatments and putting therapeutic interventions into practice within the framework of established clinical techniques. It is in the context of mentorship that a novice therapist is able to obtain the unique and advanced knowledge base required for the CHT credential. Let's go back to our mentoring scenario for Module 1. Stephanie is an OT CHT with 20 plus years of experience and a member of Generation X. Abigail is a recent graduate OT who is interested in becoming a CHT. Abigail is a member of the millennial generation and is a reflective learner. Pause the screencast and list 5 important steps Stephanie needs to take as she begins the mentoring process. Abigail is tasked with preparing for and evaluating a patient who is 1 week post flexor tendon repair in zone 2 of the right index finger. The patient presents with orders with the instructions to evaluate and treat, follow flexor tendon protocol, and make a splint. Pause the screencast and list 5 behaviors Stephanie should display as Abigail's mentor through this process, and list 3 strategies she can use to help Abigail reason through this scenario. Scan the QR code on this slide for the Mentor Handbook that accompanies this course. In the handbook, you will find the PowerPoint slides, some links to key articles, a list of hand therapy references, an example mentoring contract, an example learning styles inventory, links to the HTCC mentoring handbook, links to other hand therapy resources, and my contact information. Feel free to contact me with any questions you may have, or if you would like any other resources that may not have been provided here. Thank you for your attention and active participation in this course. I hope that it will be a valuable resource for you as you help mentor the next generation of hand therapists. Here are some references, and thank you again.